Hi, my name is Julie Ridgway. I'm the Director of Rehab Services at Summerville Medical Center. I have worked for Trident Health for just about 20 years, and I'm excited to welcome you to listen to our It's a Joint Effort, where we're going to give you all of the information for your pre-op for a total joint replacement.
Hi, my name is Jenny. I have worked for Summerville Medical for 10 years. I've been a nurse working in the preoperative department, and we're going to go over the class objectives of what to expect during this course. We will discuss what to expect before surgery, what to expect the day of surgery, what to expect from your experience while you're an inpatient here in the hospital with us, what to expect from rehab, going home, and preparing for discharge. Typically, discharge will occur about a day and a half after your procedure is complete, and we will discuss what will occur after you get discharged later in the presentation.
We will work with you while you're here to manage your pain. You're going to hear us talk a lot about managing your pain. We're going to help restore your strength, your mobility, and lead you to successful outcomes for you. And of course, we will provide you with excellent care while you're with us.
Beginning with preoperative instructions, you will arrive here at Summerville Medical at the time given to you by your pre-admission testing nurse. That time, however, is subject to change. It will not be finalized until the day prior to surgery. You will receive a call giving you a verification of that time or an updated surgical time. The morning of procedure, you should arrive at the registration desk at Summerville Medical roughly 3.5 hours prior to your procedure. Again, that time will be given to you by your pre-admission nurse. The only exception to this rule is that if you are the first case of the day, you will need to arrive when we open at 5:30 a.m. Diet. You should stop drinking all food and milk products the night before your procedure at midnight. However, you can continue to have clear liquids, things such as water, apple juice, or Sprite, up until it is time for you to drink your pre-surgical drink, as pictured here on the screen. You will receive the pre-surgical drink again from your pre-admission nurse. This drink should be completed within 30 minutes, and the timing of the drink is begun at 3.5 hours prior to procedure and completed by the 3-hour mark, so that you have 3 hours prior to procedure with nothing in your mouth. No mints, gums, candies, nothing at all.
If you are a smoker, please do not smoke the day before surgery or ever. Try to minimize it at the best you can several weeks before surgery. Smoking decreases your rate of healing 3 times. That leaves you with 3 times higher risk for any infections post-surgery.
Medications. You will work with your pre-admission testing nurse to establish a list of your current medications. This list will be what your surgeon uses to medicate you while you're here with the hospital. So please try to ensure that it is complete, including any over-the-counter medications that you will take at home, such as melatonin or Pepcid for heartburn, things like that we usually see get left off the list. You will be advised by your pre-admission testing nurse of which medications that you should take the day of your procedure. Skin prep. You will wash with a soap for 5 days leading up to the procedure and also the morning of the procedure. The soap will be provided by your pre-admission testing nurse. You will apply the soap everywhere on your body except for your hair, face, and privates. Please use your normal products on your hair, face, and privates first, and then starting at your chin and working your way down and out, you will wash with the soap provided. Please use one of the included washcloths to apply the soap. They are disposable and you will use a fresh one every day. Please make sure to use a clean towel every day. Do not put it on the hook like we all do and use it a second time. You do need a clean towel each time you apply the soap. Please put on clean clothes every day. Don't put on yesterday's pajamas or yesterday's sweatpants because all you did is lay around the house. Please put on clean sheets on your bed on the day that you begin the soap, and also have clean sheets on your bed when you return home from the hospital. You will need to leave the soap on your skin for a full 2 minutes each time you use it. If your shower is big enough, please back up out of the water to have it completely on your skin for the full 2 minutes. If your shower is too small, you will need to turn the water off to allow the soap to sit on your skin before rinsing it. You may apply any lotions, creams, or anything on your skin that you would like on any of the first initial 5 days leading up to the procedure. But the morning of the procedure, after using the soap, do not put anything on your body. No lotions, creams, perfumes, or deodorant. Also, please do not shave anywhere on your body for the first 24 hours leading up to surgery. We do not want any nicks, cuts, or scrapes, any potential sites of infection. Please use the chart that is pictured here to document when you have used the wash. This chart will be provided to you by your pre-admission nurse. When you meet with your pre-admission nurse, you will also be swabbed for MRSA. MRSA is a bacteria that can live harmlessly in our noses. We are carriers of the MRSA, if you will, but it doesn't cause you any harm living in your nose. However, if it gets into your incision site, it can cause an infection that is challenging to treat. So if you do have MRSA living in your nose, we will give you an ointment that you will use for the same 5 days that you are using the wash. Twice a day, you will apply it in your nose. The test takes roughly 24 hours to return, and you will find out at your pre-op appointment with your surgeon whether or not you need the ointment, and he will prescribe it for you. Personal belongings the day of the procedure. It's important that you wear loose-fitting, comfortable clothing in, and that you do not wear any jewelry or metal anywhere on your body the day of the procedure. We will go further into detail about what to pack later in the presentation. We keep you informed using an informer tool, which is pictured here on the screen. You will receive this again from your pre-admission nurse, and it will be more for your loved ones and family members than it is for the patient themselves. This allows the family members to get text messages updating them throughout your procedure, and you can have as many people as you would like sign up for the informer tool, whether it be near or far. Family is allowed in the waiting room of the surgery area, and we encourage you to have a person appointed to be your point person and discuss with the surgeon after the procedure so that they can give that information out to the rest of the family. We have many safety practices that we do here at Summerville Medical. This is kind of a highlight reel of some of the biggest things we do. We identify you by name and date of birth over and over and over again. You will have people who just asked you 5 minutes ago ask you again. It is just a safety measure to make sure that we're doing the right thing for the right person every time. We prevent surgical site infections. The biggest things we do are the surgical soap that you'll use for 6 days prior to surgery, previously discussed. Treat you for MRSA, if applicable, if you are positive. We also give you antibiotics both before and after surgery. Any hair that needs to be removed will only be done via clipping. Just like we asked you not to shave, neither will we, to prevent any cuts or potential sites of infection. However, the biggest thing that anybody can do to prevent surgical site infections is going to be to wash their hands, wash their hands, wash their hands. This is the #1 way to prevent the spread of infection. This applies both here when you're with us at the hospital and when you go home after surgery. Any visitors, please make sure that they're washing their hands. The next safety practice is marking of the surgical site. Both the anesthesiologist and the surgeon are going to come in and they will kind of act like, hey, what are you doing here? What are we having done today? It's not that they don't know. It's just that they want to make sure that what you say lines up with what we have. Once everybody is on the same page, they will take a special marker and mark the incision area, the surgical site, to show that this is the correct person and the correct surgery and the correct side. The last thing on the list of safety practices is the timeout. And just like at any sporting event, we stop everything that we're doing and we talk about who you are, who the surgeon is, what the surgery is, and especially what side, to again make sure that the right thing is happening for the right patient every time. Please also, if you have any changes in your history at any point leading up to the procedure, please notify your surgeon or your pre-admission testing nurse so that we can make sure that there will be no issues on the morning of the procedure.
Some things that you can do to prepare your house for coming home. You will need someone with you for the first 72 hours you are home. They do not need to be attached and at your side the whole time. And I'm a mean old physical therapist, so my goal is for you to do as much as you can for yourself. The #1 thing you cannot do when you go home is fall. Every patient will go home with a rolling walker. So, what you can do in your house is remove any throw rugs in any of the ways you will be walking. The first one, right as you come into your house to wipe off your feet, is totally fine. You'll be very aware of that. But anything else in your way, please roll up and have tucked out of the way for the first few days being home. You will be able to do stairs. So if your stairways have clutter on them, like mine with a house full of kids, put things on the stairs to carry up the next time you go. Please make sure they're free of clutter while you are navigating the stairs when you get home. Also, in your bedroom, please make sure it's free of clutter. Everything's going to take just a little bit longer. Getting in and out of bed to go to the bathroom in the middle of the night needs to not be an adventure. So anything in your way, please tuck away to the side. The bathroom, it's a place we like to do things by ourselves. So please keep any items you need within reach. We always tuck toilet paper away like it's hidden and we don't all use it. But it's going to be very hard for you to bend down into a cabinet to get it. So please place it within reach. The kitchen, because like I said, I'm a mean old therapist. You can go home and immediately do some light cooking and household duties. So if there's anything that you need, please have it up on the counter. A lot of patients will prepare meals prior to surgery so they can place them in a crock pot or some type of cooker. Please get that out of the cabinet. It's going to be hard to duck down and absolutely no climbing on step stools or chairs to reach it. What to pack? You are only going to be with us about a day and a half. So what you need to pack are any basic toiletries you absolutely can't live without. If you forget anything, we will have it there for you. However, most people like their own deodorant, toothpaste, and toothbrush. The absolute number one thing you can't do is fall. So please bring non-skid shoes with a back. The ones pictured on this slide are a great example of something you can put on easily that doesn't require tying. If you have Crocs or sandals or slippers, all of those are wonderful as long as they have a back. The other thing you need to bring is a t-shirt and loose-fitting shorts. We are going to make sure that you can independently get yourself dressed so that if your family member is not with you, you can start doing things independently for yourself. Loose-fitting shorts are very important so that we can see your knee or easily get to your hip. You do not want anything that buttons, as your hip will be a little bit swollen, and once we sit down, it will be very uncomfortable. The other thing that you can bring is a robe. Now, I'm giving you all the reasons that you can't have an excuse to not participate. If this is your time to shine and you don't want a robe to walk down the hall, by all means, go ahead. If you need a robe to feel covered, we will put an extra gown on you, but you will be walking with therapy. Although you have been asked many times by this point, please pack a list of your medications, just so that if there is any confusion, we can pull it out and in black and white, make sure we are giving you your right doses of your home medications.
So at this point, you have made it to the day of procedure. You've prepared at home and you are arriving here at Summerville Medical to have your joint replacement. You will come in the entrance marked for registration, which is located right out front when you are looking at the building from the road. You will come at the time on your sheet that has been confirmed with the call you received the day prior to surgery. At that point, you and your family members will be escorted back to a room in the ACC, or Ambulatory Care Center, the area where you'll be getting ready for the operation. At that point, you will have some things occur, such as preparing the incision site. Believe it or not, they're actually going to wash you again with the soap that you've used for the past 6 days. They will begin an IV and start you on some basic fluids, just some salt water. They will place you on supplemental oxygen. This is not to say that you need it. This is just standard treatment for a joint replacement. And they will also apply something called the sequential compression device, which helps to prevent blood clots and will be pictured on a later slide. You are allowed to have family members with you, but we do ask that you please limit it to 2 people at this time and nobody under the age of 18. They will wait during your surgery in the surgical waiting room. As mentioned previously, we ask that you have one person act as a point for staff to communicate with, and then they can give all that information out to other family members. Surgery will last roughly 2 to 2.5 hours, and recovery time will take 1 to 2 hours. The orthopedic surgeon will come out and update your family members after the procedure is over. Usually the surgeons make a comment of everything went great and your loved one will be out in just a little while. Please note that little while in surgeon time is 1 to 2 hours, so do not be concerned if your family member is still in recovery at that point.
The day of surgery, you will be visited by a nurse leader that will come and make sure that we're providing you with excellent care. You will be asked about your pain control. Are we doing a good job managing it? There will be staff that will check on you every hour. We want to make sure that while you're here, you are receiving the utmost quality of care, that our responsiveness time is acceptable, and that our communication is clear. We also want to make sure that communication between you, your nurse, your therapist, and the doctor is great the whole time you're here. On that day of surgery, when you get to the room, there's going to be frequent monitoring by your nurse. They're going to check your vital signs, and you may even have a blood pressure cuff that is going to intermittently squeeze for a certain period of time after surgery. We are going to check your surgical dressing, and we are going to frequently ask you your pain level and your description. Please be prepared to describe it. Is it sharp? Is it dull? Is it achy? Is it burning? All of those words help us communicate the best to your needs. Food. Of course, you're going to be hungry. Most patients start with just a clear liquid diet and advance to a regular diet by later that afternoon or early evening. We do encourage you to continue to drink lots of water. Every day, we're supposed to drink 8 to 10 glasses of water, but it's very important during your healing to make sure that you are well hydrated. The other thing that is very important is the incentive spirometer. We have a picture of that in just a moment, but it's very important that while you are awake, you use it 10 times every hour. On this slide, you're going to see some of the equipment you will encounter while you're here with us. Up in the corner is someone with an IV line. Most patients are familiar with this. This will remain in place throughout your stay and until you are eating and drinking normally will be attached. The nasal cannula, pictured in the opposite corner, is where we will give you oxygen before surgery, during surgery, and then till you're nice and stable on room air. The second picture on the left-hand side is a picture of the sequential compression device that Jenny mentioned. What these do is intermittently squeeze to pump your blood through your body until you are up, walking around normal. This is one of the things we do to prevent blood clots. On the right-hand side, you will see the incentive spirometer. This is very, very important in your recovery. This not only helps prevent blood clots, helps prevent any pulmonary complications. This device looks like you would want to blow into it. However, you are actually going to put your mouth on the device and suck in. This is going to be something the nurse will go over with you while you are here, but we want you to be aware of what you will see. The third picture on the left-hand side is the knee immobilizer. You will get this at your orthopedic doctor's office. Please bring that with you on your day of surgery. We're going to talk a little more in a second about why that's important. The triangular shape is called an abductor pillow. This is used for some total hip replacement patients. This is something you will encounter while you're here with your stay, and we'll describe it more throughout this presentation. The last picture on the right-hand side looks like a cooler. This cooler is going to be used while you're here in the hospital, but it is also going to go home with you. It's a great treat. What this device will do is give you continuous cryotherapy. This helps prevent pain and is also a natural anti-inflammatory. There is a little hint that one of our patients taught us about the Polar Ice Cooler. If you grab from the store the small little 8-ounce bottles of water, freeze them, and then keep reusing them as your ice portion so you don't have to worry about your ice maker keeping up with it.
As previously mentioned in the presentation, it's very important that you do not fall after surgery. We want to take precautions to make sure this doesn't happen. Some of the medications that you will be on from the procedure, both from anesthesia and for pain management, can make you a little dizzy or woozy and potentially more at risk for falling. Please do not get out of bed by yourself or with a family member. All of the things that you saw on the previous slide will be attached and will need to be removed or adjusted prior to getting you up safely out of bed. It is also important that you don't fall, because if you do, our bodies are pretty smart and they will typically fall the other direction to keep the injured side safe, and then you will have two injuries. Please make sure to keep all of your personal belongings within reach, close to you: your phone, your call bell, and any food and drinks. Remember, you want to be drinking 8 to 10 glasses of water every day, so keep your little water jug close by you, as well as your incentive spirometer, which helps to prevent post-op pneumonia. Please also try to keep your room free of any unnecessary clutter or items, as these will get in your way when you are getting up.
As we mentioned earlier, you will be rounded on every hour. Because things will take you a little bit longer to do, it's very important that when someone is in there checking on you, that you consider things like, do I need a drink? Do I need to use the restroom? If any of that becomes urgent, we are there to take care of you and get those things for you or help you get out of bed. But it's a lot easier and more comfortable for you if we can get it taken care of before it becomes an emergency.
Following surgery, we will work with you, as mentioned, to manage your pain. Unfortunately, you will have some level of discomfort, but we will work well with you to manage your pain using the following modes. As mentioned on the bottom here, you will receive a polar ice machine, which is cold therapy and can be used around the clock, unlike a traditional ice pack, which has to become off and on every 20 minutes. We also will give knee patients, total knee replacements, a nerve block. A nerve block works really well to prevent the nerve from communicating to the brain that you are having pain, and it can last anywhere from 8 to 24 hours. However, as the nerve block is wearing off, your body will start to get a little bit of sensation of pain. It's important to remember that you are in large amounts of pain. Your nerve has just been blocked from telling your brain that you are. So as soon as you start to feel a little tingly 1, 2, or 3 level pain, I encourage you to communicate that with the nurse and go ahead and get some pain medications on board. Your frontline medications are going to be your oral medications. This is what you will eventually go home with. However, we do also have IV medications for breakthrough pain. IV medications come on and relieve pain quickly, but they also don't last as long. So ideally, our goal is to get you on an oral regimen that will work for you.
As mentioned earlier, it's very important to describe your pain. That helps the nurse know if there are any other medications to put on board.
There, of course, are possible side effects from any medication that you receive. One of the biggest ones with pain medications is going to be constipation. This is a very common side effect that a lot of people deal with when they're taking pain medications. Please go ahead and get yourself an over-the-counter stool softener in case you would like to take it. You may also experience the side effects on the left side of the screen here, including dizziness, drowsiness, nausea, vomiting, headache, or fatigue. Most of these side effects you should experience while you're here with at the hospital, and we should be able to get those addressed before you go home on your pain medication regimen. However, if you are experiencing nausea and vomiting, say with a Percocet, for example, but the Percocet is doing great for your pain, we can just prescribe something in addition to combat the nausea, and that would be a good pain regimen for you. However, if you're taking the Percocet and having no side effects, but you are not having your pain well managed, that would not be a good pain medication regimen for you. So we highly encourage that you discuss with the staff any side effects or how well the pain management is working so that you can get on a regimen that will work well for you. Another thing that people often worry about is tolerance and or addiction. Please know that your surgeon will not prescribe you more than what is safe. The surgeon will not prescribe more than what is safe with you regarding pain medications. They have taken care of many patients and they know what amount is appropriate. It is normal to continue taking pain medications in the weeks following your procedure. However, it will slowly but surely be less and less. But it can be normal at bedtime when you're tired to get some rest after your day to take a pain pill at that point, or if you are going to rehab and you're sore after that you would take a pain pill after rehab. Those are all completely normal.
And we also want to note that there is absolutely no gold star given away for not using the pain medication. The goal with that pain medication is to help manage your pain to help you return to your normal function. So please know that it's important to have them on board in order to gain your greatest function during the very difficult first few weeks ahead. The other important medication after surgery is going to be the anticoagulation therapy or blood thinner. It is very, very important that you take this medication exactly as prescribed. There are some side effects that we would like you to be aware of. Any allergic reaction, dizziness, or muscle pain would be something you would probably experience immediately while here in the hospital with us. But any signs or symptoms of excessive bleeding will be very important to report to your surgeon's office ASAP. Any bloody or black stool, red or dark brown urine, coffee ground emesis or vomit, unusual bruising or bleeding. And by unusual, I am not talking about that surgical leg. It will be very clear to you what bruising will be normal. That leg may have bruising up on your thigh, and it could pool all the way down to the back of your ankle. However, if you were to slowly walk by a doorway and bump your elbow and ended up with a bruise, we would consider that excessive and unusual. There may be other signs like a bloody nose that is not stoppable, or bleeding when you're brushing or flossing your teeth that does not resolve within just a few minutes. Those are reasons to let the doctor know to make sure that your blood is not too thin. It is very, very important that you take this medication as prescribed to help prevent any blood clots. That is something to contact your doctor immediately. All right, the part you've been waiting for, physical rehabilitation. I know you've all heard it. PT, pain and torture, physical torture, all of that. Our goal is to get you back to your normal baseline and even better than you were prior to surgery. Physical therapy is going to typically begin the day of surgery. Depending on how quickly you recover and how well your symptoms are controlled, our goal is to get you up out of bed and walking that day. If you're not recovering quite as quickly or you have a procedure late in the day, one way or another, you are going to get out of bed. This may be with therapy, this may be with the nurse, or it may be with one of our patient care techs, all equally trained. Physical therapy is going to occur twice a day while you are here in the hospital. We are going to work on the big picture, walking around, getting in and out of bed, how to use that walker pictured in this slide. Occupational therapy is going to see you at least one time while you're here. If you get it and you're doing fantastic, then we will only see you once and check you off. However, we are going to work on things like getting dressed. How do I get in and out of the shower? How do I put my clothes on? You will see some of those gadgets also pictured with our occupational therapy team. The main goals with therapy are to increase your range of motion, increase your strength, increase your independence and safety with transfers, using that roller and walker, stair training, dressing, and bathing. I know you're thinking, wow, that picture of those stairs looks quite intimidating, but we will teach you to do whatever stairs you need to do at home to safely navigate your house. We will teach you based on what you have at your home. So please think about it ahead of time. Do you have 3 steps? Do you have 12 steps? Is there a handrail on the right? Is there a handrail on the left? Would you not touch that handrail with a 10-foot pole? Whatever is appropriate for your situation, we are going to navigate with you while you're here. For our total knee patients, we are going to work on range of motion in a very specific sense. You will hear the therapist often talk about how many degrees. As pictured, that is what we call a goniometer. We will use that to measure your knee range of motion. Range of motion for a knee patient has 2 ends, what we call 0 or straight, and what we call bent, which is 90, and our final goal of 120. 90 degrees is what you need to safely get up and down from a chair, in and out of bed, in and out of a car. That is our goal for you while you're here in the hospital. After you complete all of your outpatient therapy, our goal is 120 degrees. 120 degrees is going to let you climb up on a step stool, go down the stairs, squat down in a cabinet, all of those things that you've been missing out on with your sore knee. One very important measure that is consistent at discharge from the hospital and discharge from therapy is 0. If you do not get your knee to 0, you may end up with a limp. I know you didn't go all through this for a limp. One thing you can do to help yourself is do not sleep or rest with a pillow under your knee. Our fancy beds automatically bend your knees when they sit your head up. So please be your own advocate and push the leg down button. The therapist can show you that, or the nurse. Do not sleep with any pillows under your knee. If you have shorter legs, one pillow may be enough to keep your knee straight and support it. However, if you have longer legs, it may take a couple pillows to elevate your heels. In this picture, you see the knee immobilizer. The knee immobilizer is going to be important for you to wear anytime you are out of bed until the therapist discharges it. That means when you're up with the nurse, when you're up with the tech, when you're up with therapy, all of those times until the therapist says you graduate from it, you need to have it on. You do not need to have it on while laying in bed. However, there may be points in time that we encourage you to do so to work on straightening. So please take that home with you even if you've graduated from it. The first hip precaution to be careful of is do not elevate your knee above your hip. We like to think of it as not going past 90 degrees. Although it sounds silly that you do not walk around marching, but if you are sitting and bend forward to touch your toes, put your socks on, or tie your shoes, you are breaking that 90-degree range. Please follow our instructions and be very careful with that. If you are sitting on a low couch or a chair or a toilet, when you go to get up, we will teach you how to protect your surgical hip. The second thing that is very important not to do is to turn your foot inward. And I know you're thinking, that sounds a little silly too. My foot flops out when I'm not paying attention. But it's very, very important when you're standing and making turns. If you were walking and your right foot was your surgical leg and your foot was planted, and you turn towards the right to answer a phone or to answer a family friend, you are keeping your foot and turning your hip inward. That is a very difficult position for your new hip that's recovering to be in. Please be careful with that, and we will review that when you are here. The third thing is do not cross your legs. As in the picture there, you can see this lady with her legs crossed. This is not something that you will be able to do in that first 4 to 6 weeks. Imagine an invisible line from your nose all the way down to the floor. We call that midline. We do not want you to break that plane. The picture of that triangular pillow strapped around the legs may be something you encounter while you're here in the hospital. You may come up from surgery with that strap between your legs. As you are more awake and coherent and not going to cross your legs without knowing, we may take that device out, or it may just lay between your legs not strapped. Discharge plans. You will have physical therapy after you leave the hospital one way or another. Our goal for you is to get to outpatient physical therapy as quick and safely as possible. Outpatient therapy is going to get you back to your normal function as quick as possible. One of the benefits is you have to get up. You have to go about your morning routine. You have to leave the house, come to a clinic, and then reverse that. Go home and finish your day. It is very important if you are looking for an outpatient center to consider a few things. You want it to be close and convenient. You will not be able to drive at least for that first 4 weeks, so you will need someone who can get you to and from your appointments 3 times a week. You also want it to be clean and comfortable and safe and somewhere that you feel trusting. You would also very important to look for a clinic that has one-on-one therapy. I don't mean you only have one therapist, because we all have our own opinions and get from A to Z in different ways. However, while you are there, I want you one-on-one with a therapist. It's very important that they key in on the exercises and returning your muscles to their normal function. Some of these muscles haven't been working right for years. Our bodies are really smart and they compensate to prevent us from being in pain. If you are doing stellar, but maybe just need a little bit to get over the hump, Home health is a great option. This is typically set up for you while you are in your last appointment at your orthopedic surgeon's office. Home health would come to your house for approximately 2 weeks to get you safe and comfortable in and out of your house to prepare you to go to outpatient physical therapy. If you have that set up and continue to progress in a very stellar way, we can switch that to outpatient therapy while you're here with us. The other two listed, a rehabilitation hospital or a skilled nursing facility, are not the typical norm. If that were something that would be appropriate for you, we will discuss that while you're here with us. Your physical therapist will help you decide on which is appropriate and safe for you. They will be in constant communication with your case manager and the nurses and doctor to help you get to your most safe discharge plan. On discharge, some things to think about when you need to call the doctor. A fever greater than 101. We say 101 because a low-grade fever could be normal. Your body is fighting this major surgery and trying to help you heal. But anything greater than 101, please call the doctor's office. Any pain in your operative or non-operative calf muscle. This could be a sign of a blood clot. This is not going to be, ooh, I worked a little hard in therapy today. My legs are sore. This is going to be that worst Charlie horse pain in the back of your calf that you have ever experienced. It also is likely to be accompanied by swelling, redness, and heat. Any of those symptoms, please call the doctor immediately, and they will likely send you to rule out any complications. Any redness, heat, and or drainage from your incision site should be reported to your doctor, and they can make a decision if there's anything else necessary to prevent infection. Any of those signs and symptoms we spoke about earlier of abnormal bleeding could tell us that your blood is a little bit too thin, and very important to call the doctor to make adjustments to your medication. However, you do need to call 911 if you have any difficulty breathing, chest pain, or any other emergent issue. This may be completely unrelated to your surgery, but is still an issue. Please skip the doctor's office and call 911. Another important part of discharge is how to take care of your wound. You will have a bandage that is placed on your body in the operating room in a very clean, sterile environment. It is very important that we keep this bandage intact for 1 week. However, if you feel like the seal has been broken, please remove it. Any moisture or anything that gets under that bandage is a breeding ground for bacteria. When you get home, showering with soapy water is allowed and encouraged. For the first week, please try to keep that bandage as dry as you can. We encourage you to wrap it with a bag or saran wrap, or just try to keep it out of the direct line of water. Submerging your incision is not allowed until this incision has fully healed. So that means no baths, no hot tubs, no lakes, no rivers, no oceans, none of that. It is very important until your entire incision is healed that you do not do any of those things. Total knee patients will have staples. Those staples will be removed at approximately 14 to 17 days. That will be done in your surgeon's office. At that time, they will place steri-strips over the incision, and it is very important to keep those intact until they fall off. They may fray and cause you some aggravation by catching on your shorts or your pant leg. You are allowed to trim them, but please do not remove them until they fall off from the very center of your incision. Total hip patients typically have a different bandage. After you remove that bandage at 1 week, the piece of gauze that's attached, please leave there until you see the doctor. The doctor will fully remove that at your follow-up appointment.
Discharge plans going home after your procedure. As you are discharged, the nurse will go over any information related to when you should next take your medications, including your pain medicines and your blood thinner. They will also review any and all follow-up appointments, including the appointment with your surgeon and outpatient rehab or home health, depending on which route you go. Please note, as in the previous slide, you will need to follow up in the 14 to 17 day range with your surgeon in order to get the dressing staples removed or the gauze dressing removed, depending on which surgery you had. So if your surgery has been moved, please ensure that also your follow-up has been moved. Driving, you will not be able to drive for at least the first 4 weeks, but you will follow up with your surgeon and he will discuss with you when it is appropriate for you to drive. Equipment, you will go home with a walker. We encourage you to please not bring the walker here to the hospital with you. Use ours while you're here and leave your walker in the getaway car or by the front door of your home. And you may, however, also want to obtain a bedside commode or a shower chair. These can be hard to get through insurance, so if you want to buy them either through a pharmacy or online on Amazon, or get them from a friend, or even from Facebook Marketplace or any kind of secondhand store, these are all good options as well. They are not necessary, but they will make your life a lot easier at home if you have them. Any chair that is waterproof and resistant to moving on the shower floor is technically a shower chair. If you are able to obtain these items prior to surgery, we do recommend it. If you have any questions from this presentation, please jot them down and either bring them with you when you meet with your pre-admission testing nurse or call your surgeon's office with any questions you have.
We want to thank you for listening to our presentation and thank you for choosing Summerville Medical Center. We wish you the best of luck with your surgery and we'll see you soon.